everyone, I'm Dr. Anchal Makhija, Patient Support Group Counselor. This video is supported by Triumph, powered by Mohan Foundation. And also this video is powered by SBI Cards and SBI Foundation. In this video, we'll be discussing about UTI or urinary tract infections and how to prevent and manage these urinary tract infections for dialysis and transplant recipients. Okay, to understand UTI, let us understand first the urinary system. So urinary system में there are two kidneys, there is ureter, there is bladder and there is urethra. ये बैक्टीरिया कैसे एंटर करता है हमारी बॉडी में थ्रू इन द यूरिनरी सिस्टम इज जब हम अनहाइजीनिक वॉशरूम्स यूज कर रहे हैं व्हेन वी आर नॉट क्लीनिंग दैट system, when we are not cleaning the genitals outside area properly. So the bacteria is the main thing जो कि entry point मिलने से it spreads rapidly, fastly in the urinary system. So that is the main entry point, and this is how the urinary tract infections start or begins. So now let us discuss the common symptoms of urinary tract infection. Very common symptoms is हमें बहुत urge हो रहा है urine pass करने का, but the urine is not freely coming out, or we are feeling heaviness or bloatingness there. Also there can be the burning sensation, the foul smell from the urine, the cloudy urine, or you can say there are some blood spots in the urine. These are very common symptoms जो कि हम initially experience करना शुरू कर देते हैं, and the moment we experience these symptoms we should be very at a high alert that something is not right. It has begun, the infection has started to begin and enter into my body, and we need to start taking action right away. Apart from this, there can also be a pelvic pain, because of the not able to pass urine properly. So these are some common symptoms which we need to identify the moment we feel something is not right. Now let me tell you what are the common factors that increase the risk of urinary tract infection. So first and very important is poor hygiene. We are not maintaining the right hygiene. We are not able to use the right, the hygienic washrooms, or we are using the public toilets. That is the biggest risk. Right. Second is maybe in women there is a menopausal problem, so that can also be the risk for frequent urinary tract infections. Another possible risk can be the use of different birth control methods we use. So that can also cause the risk of a urinary infection, like some IUDs we use for the birth control. Another risk is the weak immune system, particularly the immunosuppressants given for the transplant recipients, that weakens our immune system. That can also be another risk factor for having the more prone to urinary tract infections. Apart from that, there can be some urine tract abnormalities which is there in some of the people, which can cause or result in frequent UTIs. So these are some risk factors which we need to identify in our life, in our body, that what is that one factor which is giving me UTI again and again. Okay, so now let us discuss how to prevent UTIs. First, very important point is to stay hydrated. Drink as much water as you can, minimum 4 to 5 liters per day. Especially in summers, you can have a lot of water and popsicles, or ice cubes made of fruits. So you have to stay hydrated. Drink lots and lots of water, plenty of water, which flushes out bacteria from the urinary system. Okay, so apart from that, we need to practice the good hygiene. In that case, we need to, carry the P-safe sanitizers where it is available easily these days. So जहाँ भी हम जा रहे हैं, either it is a washroom, a hospital washroom, or a personal washroom, we need to make sure the area is clean and free from infection, because that area is always the source of infection. Using our personal washrooms, not using common washrooms at home as well. When it is a public place, of course, we need to carry the sanitizers or Dettol diluted sanitizers, which we need to spray before using it. Always carry tissue papers alongside you, right? So apart from that, we need to clean our genital areas after using after urinating. We need to clean it from front to back so that there is no risk of infection. Third point is to urinate frequently. We need not to hold our urine for a longer time, longer duration. It is very important to go repeatedly and urinate it properly. Even if you are not feeling an urge, try to have go to the washroom every 1 hour. Next point to prevent a urinary tract infection is to wear breathable underwears or undergarments made up of cotton, which easily allows there is a movement of air around that area. Also, try to avoid tight fitting pants, because that gives a lot of pressure around the urinary bladder area, right? Last point is to avoid irritating products, for using or washing of genital areas, because it removes or it imbalances the pH of that level. Avoid using shampoos, avoid using fragrances, avoid using soaps, harsh soaps. Sometimes, feminine hygiene sprays are also available. So we need to make sure the, repeated usage is not there, which will imbalance the pH levels of that area. So these points are really important to prevent the risk of repeated urinary tract infections. Also very important is to urinate properly and stay hydrated, which is the key to prevent urinary tract infection. So now lastly, we will discuss about the management of urinary tract infections. If you are, repeatedly having UTIs, first and foremost is to first seek medical attention. Go to your doctor, go to the urologist and discuss your issue with them and share your problem with them. Because proper diagnosis and receiving a proper treatment is another step to prevent further infections. So seeking medical help, seeking medical healthcare providers help is the first step to manage urinary tract infection the moment you recognize it. Second point is to take prescribed antibiotics. Do not take self-medications. Do not, be your doctors thinking that, oh, this is your common thing for me now. I can take the medicine because earlier this medicine was prescribed by doctor. No. Take the medicines, proper antibiotic course prescribed by your doctor only. So as per their schedule, as per their, diagnosis, as per the tests, results, they will prescribe the medicines. Another point is to, again, how to manage it. Drink plenty of water. Drink lots and lots of water and flush out urine even if you are not having urge of it. So these are the steps, easy steps to follow to manage your urinary tract infections. And you have to, of course, keep revisiting your doctor until you feel better. So remember, prevention is better than cure. So always be very on the top of your toes, to be very mindful while using all the washrooms. While after using every washroom, be very, very, very much cautious and mindful of every washroom visit we do, so that we can prevent the urinary tract infections in our body. So I hope this video gave you some information. So if you like the video, please share, subscribe. Thank you so much for watching this video. Please stay healthy, and please share and subscribe to this channel.